So I'm here today to talk about the induction guidance that the Council's produced called Preparing for Practice. And I thought what we'd do to start off with is say a wee bit about what it is, say a wee bit more than exactly what it's not. And it's always interesting when you put something like that and think, well, what is it not? Well, it should be obvious what it's not. It's not always. Who's it for and what the audience is? Well, what it is, well, it kind of says what it is. It's guidance. And it's meant to be guidance. So preparing for practice, the kind of subtext of that is induction guidance for social service employers in Scotland. And it is very much intended as guidance. Which leads me to what it's not. It's not prescriptive, it's not regulation, it's not requirement, and it's not standards. We got a lot of phone calls, and we continue to get phone calls in the council for folk saying, where can we get your induction standards? Well, it's really easy, the answer to that one. You can't get them because we don't have them. And I think people ask because our equivalent in England, in the Sector Skills Council side, Skills for Care, produce induction standards, induction and foundation they used to have. I think it's now just induction. And we kind of looked at it and thought, well, no, we don't want to go down that road because we've got national occupational standards that folk have to engage with to do their SVQs. We've got national care standards that they have to engage with in terms of regulation of service. Do we really want to put another layer of standards in? And we kind of came to the conclusion that we didn't, because standards is a much abused word. People throw it around as if everybody understands what we're talking about. And everybody assumes that we're talking about the same thing, when actually we might not. So it's not standards. Who it's for? Well, it's for social service employers and employees. It's for anybody in our sector. And I'll just emphasise the point that Wendy made, we're not just talking about the social care workforce, we're talking about early education and childcare, or I think the new word is daycare for children. I've got a colleague whose ears will be burning if I get it wrong. So I think it's daycare for children's services and housing support services. So it's across the board. And in the development group, there was representation from that broad suite. And we had employers from local authorities and from the voluntary sector involved in actually writing the stuff. And we had, let's say, representation from early education and childcare and housing support involved in actually writing the guidance. So we've done our best to try and write it in a way that it talks to that broad audience. Because what we didn't want is to put out guidance and folks say, well, that doesn't relate to me because I'm in early education, and you don't mention anything in there that actually relates to me. In terms of content, there are basically 6 sections to the guidance. I was just saying to Linda at the front here that I tend to think in pictures. So I like to have something that helps me remember information because, as they say, old age doesn't come itself, and I keep forgetting stuff. So thinking in pictures helps me immensely to keep all this stuff in my head. And because there were 6 sections, we tried to come up with something that we could get 6 sections in. And we had overlapping circles, and we had a variation of the Olympic badge and all that, but there wasn't enough circles. And then somebody mentioned trivial pursuits. And I thought, oh, how appropriate. Trivial pursuits for induction guidance. So that's where this came from. But it's a representation to help folk remember there are 6 components in the guidance. And it tries to cover all the things that Wendy had on the screen, the messages from service users and carers. It tries to talk about the broad general stuff in terms of introduction to social service practice, the kind of value base, and some stuff about organisations, but it tries to also address what do you need to do in terms of the service specific issues. It's the bits about where exactly are you working, who exactly are you working for, and what are your key tasks. So what is it you absolutely need to know? So it tries to go from the generic to the specific. I'm going to go through each of the 6 sections just briefly to try and give you an idea about exactly what's in there. The value base for the guidance was very much drawn from the codes of practice. I suppose I kind of started with the viewpoint, if it's already there, why reinvent it? And you might say that's a wee bit lazy, but we started with the codes of practice. Everybody in the workforce has to sign up to and adhere to the codes of practice for social service workers. So it made sense for us that the value base that was captured there was also the value base that was captured for the induction. In terms of introduction to social service practice, we tried to keep broad themes here so that it would speak to everybody potentially in the workforce. So it talks about the obvious things: communication, protection of vulnerable people, personal safety, ongoing learning and development, etc., etc. It also mentions registration as well. Okay. Obviously, at the point of induction, it's important to know something about the organisation you're working in, and this is where things start to get a wee bit more specific, because you do need to understand the policies and procedures of the organisation you're in. You need to know about health and safety. You need to know about the data protection arrangements and freedom of information and how that applies in the workplace. How does your organisation address these things? In today's world, you also need to know about appraisal and the arrangements for access to learning and development. We all have a requirement on us to maintain our professional development. So what's the organisation's arrangements for delivering that? Because the responsibility is a dual responsibility. You have a responsibility as a worker to engage with, the employer's got a responsibility to facilitate that engagement. And we also felt it was important here to introduce issues around quality assurance or quality enhancement. So it's not just enough to provide any old service, you want to know you're providing a quality service. And how do we get into defining what quality is? I guess that's a debate for another full morning. In the service-specific issues, again, you kind of move from what are the kind of generic skills that you need, the generic knowledge and skills in a service, but what are the specific bits of knowledge and the specific skills you might need to work in any given environment. And it talks about legislation, policy and procedure, again for a service standpoint, and there's some stuff in there about orientation to service. Because induction might not just be about folk coming brand new to the workforce. Induction might be somebody moving from one service to another, or moving from one organisation to another. And if there's anything that you kind of get a grip of quick where we work, is that people make a lot of assumptions. We were talking about assumptions earlier on. People make a lot of assumptions that if I'm a worker with a certain title in one organisation and I go to the next organisation and it looks like the job's got the same title, it must be the same. Wrong. If you're doing workforce planning in the council, we have to very quickly go to job categories rather than using job titles, because a job title can cover a multitude of sins, and it can mean very, very, very different things from one organisation to the next. And when we're doing National Occupational Standards Development, we just avoid job titles entirely, because across the UK, what somebody describes as a support worker in Edinburgh can be wildly different to what they describe as a support worker in Cardiff. And the problem is, it's a bit like the word standards. People use the terms as if it means, as if everybody understands what we mean by the term, but we don't necessarily. And it's these assumptions that trip us up.